Hey everyone, welcome back to my channel, and today I'm going to be discussing the pros and cons of bedside nursing and clinic nursing. So a little work update about myself. I actually started a new position in September working as a flex clinic nurse between 4 different surgical clinics at a pediatric hospital. So I'm still at the same hospital, but now my job is to rotate between 4 different specialties. So urology, general surgery, gynae, and plastic surgery. And I pretty much rotate on days where certain clinics may need extra nursing support or to cover vacation and absence of nurses in those clinics. I'm still casual in the NICU, and that will forever hold such a special place in my heart. I really enjoy when I get to go back and see friends and spend time with the babies, of course, but I really wanted to transition into this new role that I took on in the fall because actually, another life update, recently finished my master's a couple weeks ago, and with that completion upcoming, I really wanted to gain experience with a wide age range of the pediatric population, because since I started nursing, I've only worked with newborns. So I really wanted to expand my training and get to work with a wider age range. So starting off with bedside, we'll start with the pros. First pro of bedside is you get, I would say, more hands-on experience. If you're someone that really enjoys nursing skill work with your hands, you may prefer bedside because I would say that you get more time, obviously at the patient bedside with the patient, performing nursing skills with your hands. Not to say that you don't get that in clinic nursing, you definitely do get some hands-on skills, but not as often or frequently as bedside, I would say. Another pro of bedside, which I personally miss, is you can get vacation or stretches off without using as much vacation time because you're working shift work. So whatever it may be, 4 on, 4 off, 4 on, 5 off, depending on your hospital policy and scheduling. Personally, in the unit that I used to work full-time in, it was self-scheduling. So as long as you fit the amount of shifts you needed for your FTE within the 6-week period, it didn't really matter where they were placed. Obviously, the scheduling committee would move things around to fit the unit needs sometimes, but that is, I would say, definitely a big benefit of bedside, is getting to take those extended days off without using any vacation time or as much vacation time. Because now working Monday to Friday, my vacation time goes so fast. Another pro of bedside nursing is definitely getting those random days off during the week, say a Monday or a Wednesday, to go get your errands done, go get groceries, or even take an afternoon workout class. Everything is so much less busy than trying to do all your errands and things on the weekend or after work, so that was a nice perk for sure of bedside. Another pro of bedside would be for people who commute. You don't have to come in as many days a week. If you're working Monday to Friday, that obviously requires you to come in 5 days a week most often. Unless you have a hybrid clinic position, then you have a little bit more flexibility with that. But in comparison of working the 8s and having to come in more often to do your 8-hour shift versus working the 12s, like a typical bedside role, and getting them done and only having to commute, say, 3 days a week. Another pro of bedside, this could be a con depending on the type of person you are and what type of work environment you like. Bedside, in my experience, tends to be busier than the clinic environment. So if you're someone, you like the hustle and bustle, you like to be up on your feet and busy, and you think that that makes your workday go by faster and you like it, then that might be a pro for you. But not to say clinic environment can definitely have some busy times and busy days, but in general, the floor bedside tends to be more busy. Another pro of bedside is premium pay. It's not that much of a difference on top of the hourly, but those $3, $5, $6 extras per hour, depending on if it's a night shift, a weekend night, they can add up and make a difference. And technically you get your Starbucks for free when you're getting shift premiums compared to not getting them in clinic. That's girl math. Now moving into the cons of bedside. First con of bedside nursing is you work 24/7, 365 days of the year. So you're working holidays, weekends, Another con of bedside nursing is the unpredictability of your schedule. So when you're working 4 on, 4 off, or 4 on, 5 off, in comparison to clinic schedule, with clinic, you know you're off at 4 or 5. You're gonna be free on a Tuesday, 2 months away for dinner. You don't have that amount of flexibility or knowing ahead with bedside because your shifts do alternate based on the schedule. And another con of bedside nursing is the shift work. 12-hour shifts, they can be hard, especially night shift. I found that switching over to mostly daytime hours now and a Monday to Friday schedule, I feel much better. I feel more energized. After a stretch of night shifts, I used to feel so dead. My skin would feel terrible. I'd feel so exhausted. Sometimes I would feel nauseous going to bed after a night shift. And there's been much research done on the long-term health impacts of working night shifts. It's known it's not great for your health to stay up for extended periods in the night. So with working a more regular clinic schedule of daytime hours, it can be beneficial for your health and helping you feel your best. Now moving into the pros of clinic nursing. First one is work-life balance. I will say it's much easier to have a better work-life balance when you're working Monday to Friday, 8 to 4 or 8 to 5. You have your evenings free, you have your weekends free, your holidays free. So it's much easier to make plans in advance and know that you're going to be off. And with that kind of goes along with the last one, but another pro is the predictability of schedule. You know you have your weekends, you know you have your evenings. If you want to go to dinner and a show in 4 months, you know that you're off to do that. Another pro could be a con depending on the type of work you enjoy, but it is less hands-on and I would say more communication computer-based at times. Not to say you still get your nursing visits or you still do certain nursing tasks to assist doctors in clinic, but in my experience, you definitely get a bit more computer and communication time in the clinic environment. So for example, answering family questions or emails on the email or telephone, returning emails and phone calls to parents, and sometimes helping with a little bit of admin work with referrals and getting faxes, filling prescriptions, getting doctors to sign forms, things like that. Another pro of the clinic nursing role is no 12-hour shifts. This can be a pro and con depending on who you are. Some people like to get it done, but I personally enjoy working the 5/8s. I don't live too far from the hospital, so commuting's not an issue for me, and I enjoy the 8 hours. It's nice. You go in at 8 and you're out at 4. Moving into the cons of clinic nursing. First con, like I had mentioned in the previous list, you do have to use more vacation time just because you are working the Monday to Friday. You don't have as much wiggle room to kind of play around with your schedule to get stretches off. Next con is working a 5-day work week. Your weekends go by so fast. When you just have the 2 days off, it feels like there's never enough time to get everything that you want done between cleaning up the house, getting your errands done. Having only 2 days can be kind of tricky. And then the other con of clinic nursing is if you commute from far, you have to commute more often, and I think that could definitely be a big con, and if I personally lived quite a distance away from work, could be unappealing about coming in 5 days a week. But again, with some clinic roles, there is a bit of room for hybrid work from home, so it really depends on the position. In my clinic job specifically, because I'm covering absences or being extra support when it's needed, I don't have the option of any hybrid, but I know there are clinic main nurse roles where you do get that flexibility. For a new grad, I wouldn't personally recommend going directly into clinics. I think it's beneficial to get a bit of bedside experience, whatever specialty you're most interested in, just to gain a bit more hands-on experience at the bedside. And I feel like my experience bedside first allows me to feel more confident and comfortable answering parent questions and emails, and when they're explaining things to me on the phone, I can kind of visualize them from my experience at bedside. But again, I'm never going to be the person to deter someone from doing what they want to do or doing their dreams. Personally, I dealt with that myself when I started out and wanted to go directly into the newborn intensive care unit. I had senior nurses tell me that that wasn't a great idea because it's so niche and specialized, And a lot of people believe that you should do general med surg for your initial years when graduating, but I knew in my heart I was passionate about NICU and I wanted to do it, and I'm so glad that I listened to my heart and went directly into it. So if your heart is telling you that you want to do clinic nursing, do it. If you feel passionate about it, do it. I'm just recommending, I think it's helpful to have a bit of bedside experience prior. In my role now, it's a little bit different than a standard clinic nurse. If you're the main clinic nurse, you really get to be fully integrated with a particular specialty and a particular team and really get to know that specialty in depth. With my role, I'm alternating between 4 clinics, which has its pros because I'm always seeing something different, something new. It's not stagnant, which I like. And I get to know a little bit about everything, but you never get to absolutely master or be the expert in one specialty because you're not there enough. But it's interesting for me because I like moving around and seeing the different teams, working with the different specialties. So that in itself, there's so many options in clinic. You can do a job similar to mine and move around and you get to see new and different things, or you can be the main clinic nurse in a clinic and really get to be an expert on one specialty. Thank you so much for watching this video. I hope you found this helpful. In my experience, I love both bedside and clinic nursing, and when I get to go back and pick up bedside, I really enjoy it, and I enjoy the work-life balance that clinic allows me now, and I love that position as well. So there's really pros and cons to both. For me, myself, it's so difficult to choose which one I like better. I hope this video gave you a little bit of insight if you're in the middle of deciding yourself. If you have any video ideas, please comment them below and don't forget to like and subscribe.